All right, let's get right into it. Today, we're going to break down a really powerful teaching technique that's perfect for busy clinical settings. Seriously, it can completely transform how your learners present cases. So, as a clinical educator, does this sound familiar? You ask your resident or student to present a patient, and what you get is just this fire hose of information, a huge list of facts, but with no clear story. And it leaves you wondering, are they just, reporting the data, or are they actually thinking like a clinician? For so long, the model has been completely preceptor-led, right? We jump in, we ask all these rapid-fire questions, and honestly, it can be pretty intimidating for the learner. But there's a much better way, an approach that's learner-centered and really pushes for active reasoning in a space that feels, and this is key, psychologically safe. The thing is, the traditional case presentation can feel more like a ritual than a real learning experience. It turns into this performance, this data dump, where the actual goal, which is to figure out the learner's thought process, just gets totally lost. We miss this huge opportunity to see how they're connecting the dots. And that old, intimidating method of just grilling the learner, what it really does is destroy this absolutely essential concept, psychological safety. This is the bedrock of real deep learning. If learners don't have it, they're just afraid to be wrong, they won't voice their uncertainty, and their growth just completely stalls out. So the goal here is to make a really fundamental shift. We've got to move our learners away from simply reporting a list of facts and start guiding them towards actively reasoning through the case. And to do that, we need to create a very specific kind of environment, what we call a learning zone. The learning zone is this perfect blend of two things: high accountability, where we expect learners to think critically and really own the case, and high psychological safety, where they feel supported enough to try and even to be wrong. This is the sweet spot. This is where the real growth happens. Okay, so how in the world do we create this learning zone in the middle of a crazy busy day on the wards? Well, that is where the SNAPPS method comes in. It's this practical 6-step framework that puts the learner right in the driver's seat. So let's break it down. So here they are, the 6 steps: summarize, narrow, analyze, probe, plan, and select. Now, what should jump out at you right away is that every single one of these actions is started by the learner. This isn't about us, the preceptor, pulling information out of them. It's about the learner pushing their own thinking forward. Okay, step 1, summarize. The instruction here is absolutely key. The learner has to present a brief, focused summary of the history and findings. This forces them to synthesize, to decide what's most important right from the get-go.
Let's use an example to make this real. Instead of some 10-minute monologue about a patient named Eric, the learner presents this: a tight, 2-sentence summary. It immediately frames the clinical problem. We know the patient, the core complaint, how long it's been going on, and what's already been tried. Perfect.
Step 2, narrow. Now, this is such a critical step. Instead of just listing every single possibility under the sun, the learner is asked to commit. They have to narrow their differential diagnosis down to the 2 or 3 most likely or important possibilities. So continuing with our case, the learner says this: see what happened? They've processed that summary and are now actually forming a hypothesis. This isn't just a random list, it's a real act of clinical reasoning. Step 3, analyze. Okay, this is where the magic really starts to happen. The learner can't just list the differentials. They have to analyze them. They have to actively compare and contrast the possibilities they just named, justifying their thought process right there, out loud. And a great way to structure this is to get them thinking in categories, like most likely, plausible alternative, and that critical, not to be missed diagnosis. This teaches the learner to prioritize and weigh the evidence for each one, which, it's a cornerstone of advanced clinical reasoning. Step 4, probe. Now, this one is a total game changer because the script gets completely flipped. Instead of the preceptor going all the questioning, the learner is prompted to probe the preceptor. They are given the space to ask about their own uncertainties. This simple question completely shifts the power dynamic. The learner shows their thinking, and then they actively ask for help. It creates the perfect coaching moment. Now the preceptor can fill in a gap, maybe by suggesting they also consider septic arthritis, without ever making the learner feel like they were put on the spot. Step 5, plan. So once the differential has been talked through, the learner takes the next logical step. They propose a specific management plan for the patient, covering both the diagnostic workup and the initial treatment. So for Eric, our patient, the learner proposes this concrete plan. It shows they're not just thinking about the diagnosis, they're thinking about the next steps and are ready to take ownership of the patient's care. And finally, step 6, select. This is the step that really closes the learning loop. The learner is asked to identify a knowledge gap that came up during the presentation and then select a specific issue for their own self-directed learning. And there it is. The learner articulates a clear, focused learning goal that came directly from a real patient case. This makes the learning so much more relevant and sticky, and it reinforces a habit of lifelong self-directed improvement. So SNAPPS is a fantastic tool for running case presentations, for sure. But its real power is how it connects to the bigger picture of how we all develop as clinicians over time. What's so crucial to understand is that SNAPPS is the how-to for moving a learner along this developmental pathway. You're actively coaching them from just being a reporter who lists facts, and you're pushing them to become an interpreter who can explain the data and a manager who can make decisions. And why does this deeper reasoning matter so much? Well, because it trains future clinicians to look beyond just the simple biology. A patient's health is determined by so many different factors, and tools like SNAPPS encourage the kind of thinking that takes in the full context, including socioeconomic factors that can account for a massive 40% of health outcomes. It helps build clinicians who treat the whole person. So as we wrap up, I'll just leave you with this challenge for your very next teaching encounter. What is one small change you can make? Maybe one question you can ask differently tomorrow to start that shift in your learner from passive reporting to active reasoning. Thanks for tuning in.